Hello everyone. Since February is Heart Health Month, we'll be learning about pulmonary valve stenosis. This is also a heart condition that I was born with, along with my oldest daughter. So our lesson objectives for this lesson, we will be learning about what pulmonary valve stenosis is, some symptoms, the causes, complications that can occur, and some of the treatments. And then at the very end, we'll go over a activity. So what is pulmonary valve stenosis? Pulmonary valve stenosis is a congenital heart defect, so it is a birth defect of the heart. It's a condition in which there is a deformity on or near the pulmonary valve, which you can see right here in the diagram. And it makes it hard for blood to flow from the right ventricle to the lungs. And in our next slide, I'm going to be going over the difference between a normal pulmonary valve, how that looks, and what a pulmonary valve with the stenosis is. And the word stenosis literally means narrowing. So here you can see we are comparing and contrasting what a normal valve anatomy looks like versus a pulmonary stenosis anatomy valve. So in your normal valve, you have these three pieces of tissue here. They're called cusps, and they're arranged in a circle and are open so that the blood can flow. These arrows indicate the direction of the blood flow. When you have pulmonary stenosis, the three cusps of the pulmonary valve, they're not separated properly. There's no perforation. They're thickened. Um, the narrowing of the valve is so small, you can see right here that the blood has a harder time flowing through. And when you have a normal valve, the valve is open in the direction of the blood flow, like we said. These arrows kind of indicate that. And then from there into the pulmonary artery and continues to the lungs. Lastly, the valve closes to prevent any blood from flowing backward into the heart's right ventricle. So what are some symptoms? Some of the most common symptoms are a heart murmur. Almost everybody with this has a heart murmur. You have your bluish color lining your lips, maybe your fingertips, that just indicates that you have low oxygen levels. You have a shortness of breath, hard or fast breathing. You feel tired, especially after physical activities and exercise, and that's also from your shortness of breath can come from that. You have swelling of the legs, ankles, feet, your face, your abdomen, and I've also heard people saying that when they have this condition that their fingers get really swollen. You can have chest pain and fainting. Now, some people with mild narrowing of their valve have little to no symptoms. The more severe the stenosis, the more likely you're going to have symptoms. And however, symptoms of pulmonary stenosis can look like other health conditions, so make sure you see your doctor for a proper diagnosis. So, what are some causes of pulmonary stenosis? Doctors don't know exactly what the cause is. They know that it occurs when the pulmonary valve doesn't grow properly during the fetal development. Some cardiologists now believe they've figured out that this occurs around the 8th week of pregnancy. However, it's not a result of something that the mother did or did not do. It just can't be prevented. However, with advances in technology and genetics, maybe someday we'll figure this out. And like I said, it does have genetic components. I have this condition. When I was pregnant, my cardiologist told me that I had a 10 to 20% chance of passing the defect on to my children. And sure enough, my second child did get this defect. So, what are some of the complications? You have a higher risk of developing bacterial infections in the inner linings of your heart. People with heart defects and heart conditions, they may need to take antibiotics before and after dental work in order to help prevent these bacterial infections from occurring. In severe pulmonary stenosis, the right heart ventricle has to pump harder, work harder to force that blood to the pulmonary artery. Eventually, because of all this extra work and harder work that your heart has to do, it can become stiff or weakened. You can have heart failure, like I said, irregular heartbeat or like the heart murmur thing. Um, so that's why it's really important that you get regular checkups with your cardiologist so that they can monitor your heart and how it's functioning. Treatments. What are some of the treatments that you can get when you have pulmonary valve stenosis? Generally, with the treatments, there's a high success rate, and most of the people when they get these treatments, they can expect to lead normal lives with no physical restrictions whatsoever. It is, like we said, recommended that you get regular follow-up appointments to evaluate your condition. This is a lifelong condition, so it's proper, it's so improper. It's proper and important to get these follow-ups. And when you have mild or severe cases, they may worsen over time and may require you to go back in and get additional procedures done. When I was born, I had open heart surgery for my condition, and eventually, 7 years later, I had to go back in and get additional treatments. I had the heart catheterization done, and we'll kind of go over what some of these treatments are in the next couple slides here. So one of the popular treatments or the most common treatments nowadays is a balloon valvuloplasty. This is where the doctor inserts a thin, flexible tube, which is the catheter. You can kind of see it here in picture A. Here's your catheter. Into an artery or vein through your groin. Some people have had them through their vein in their arm, and they've now been starting to do them through an artery in your neck. And they thread that up to your heart, and then they put a balloon through that catheter. Here you can see that in picture B. Inflate that balloon through the opening of the pulmonary valve to kind of stretch it open. And when that happens, you can see in picture C here, they inflate the balloon, it widens the valve to increase that blood flow, kind of help open those perforations of those cusps, and then they take the balloon out through the catheter, and then they eventually take the catheter back out. So when my daughter had this, she had this procedure done when she was 6 months old, and it took about 4 hours to complete. We went into Children's early in the morning, and after the 4 hours of the procedure, I think we had to stay for an hour or so afterwards for observation, and we were home in time for dinner that same day. So the technology advancements are it's just crazy. So when you have a very severe case of pulmonary stenosis, you open heart surgery is more than likely required. And during that surgery, the doctors will go in and repair your pulmonary valve or even replace the valve with an artificial valve. And if they're just repairing the valve, they'll do something very similar to what they did with the balloon valvuloplasty. However, because it is a severe stenosis, they do have to open you up. And like I said, the technology is so advanced that majority of pulmonary stenosis patients can go without having open heart surgery anymore. So now that we've kind of talked about what pulmonary stenosis is, in order to reinforce our understanding of how a heart pumps blood, we are going to make a homemade heart model work. And to do this, we are going to get into groups of 2 to 3 people. We're going to pass around these homemade heart models to each group. You can see them in the picture here. You are going to fill 2 of the bottles with the water that's been dyed red. And we're going to explore how blood flows from one chamber of the heart to the next. And how we're going to do that is one bottle will represent the atrium of your heart. The second bottle, the middle one, will be the ventricle. And your third bottle will represent your lungs or your body. And now your fingers are going to function as the valves of your heart. So you're going to squeeze only the middle bottle to make your heart model work. And you're going to start by pinching the straws between the atrium and the ventricle. So that's the first 2 bottles with the red dye in it. And you're going to squeeze the middle bottle and watch the blood squirt out into the body, which is over here, the clear one that's supposed to be your lungs. And keeping the middle bottle squeezed, move your fingers and pinch the straw between the ventricle and your lungs. Then you'll release the middle bottle and watch the blood move from the atrium to the ventricle. And you'll repeat this process. And once your blood in the atrium gets too low, you can take blood from the body or your lungs and add it back to the atrium and then start all over again, and you can keep repeating the process. And while you're doing this, I want you to watch as you do this and watch as you do the work of the valves when you pinch the straws. What happens? What happens to the liquid in the straws? So ask yourself these questions, try to answer them, and hopefully this gives you an understanding of how blood is pumped from your heart into your heart and out, back and forth through your body.